Welcome everybody to our rapid revision video. On pediatrics, we'll start with central nervous system infections. So CNS infection. Basically CNS infections are meningitis, the infection of meninges, and encephalitis, infection of brain parenchyma, and meningoencephalitis. So infection of both brain and brain meninges and brain parenchyma. So another infection is brain abscess. In examination, most of the important thing is causative organism. The causative organism may be virus, bacteria, fungus, or parasite, but the virus one is most common organism to cause a CNS infection. Common causes of meningitis. So, on the basis of age group, we have to know the causative organism. Between 0 to 6 months, newborn. So, group B streptococci is the most common organism, and the E. coli is another, and Listeria is another organism. In children, 6 months to 6 years, the streptopneumonia is the most common, and then Neisseria meningitis and the H. influenza type 13 is third most common. Between the 6 years to 6 months, the most common organism is streptopneumonia. And another most common organism, Neisseria meningitis, and other organism include H. influenza type 13, enterovirus, herpes simplex virus. And above 60 years of the age, most common organism is streptopneumonia, and other organism gram-negative rods. The other organism on the basis of age group, if they directly ask neonates, you should take the group B streptococci. And group B streptococci, Streptoagalacticus is a most common organism. So E. coli is second most organism, and between the second month to 3 years, streptopneumonia is most common organism, and between the age of 3 years to 20 years, meningococci is the most organism, and above 20 years, you can take pneumococci. Basically, clinical feature, another important topic on CNS infection. In newborn is basically they present with the refusal to suck, the poor feeding. And in clinical features, symptoms, the onset is acute, and the symptoms are fever, irritability, headache, shrill cry, bulging fontanelles, projectile vomiting, and altered sensorium, and seizures. These are the symptoms present in the meningitis. So signs, and there are 4 signs, basically McEwen signs, Cornick sign, and Brudzinski sign, and tachycerebral. So McEwen sign is also known as crackpot sign. So sign in which percussion of skull, they generate a cracked, the signs seldom prominent pot sign, physiological if anterior fontanelle is open. So this is a crackpot sign, also known as the McEwen sign. Another sign is Cornick signs. You can look at pictures of the Cornick sign. So extension of knee, and restricted less than 135 degree when hip is also flexed. Then sign elicited, pain is elicited on back of the thigh is called as a Cornick sign, and Brudzinski sign. So on flexion of neck, there is a flexion of hip. So pain is elicited on flexion of neck, and there is flexion of hip called as Brudzinski sign. And tachycerebral of skin of the abdomen is lightly scratched, and flossing may be seen. This is called as tachycerebral. So another heading is treatment of meningitis. So for empirical therapy, the third generation ceftriaxone or cefotaxime is a treatment of choice, and vancomycin also used. So after getting culture and sensitivity report in meningitis children, so we should start with third generation cephalosporin. So that is either ceftriaxone or cefotaxime, and vancomycin we can use. So complication is another topic on the meningitis, which is important. The seizure is the most common complication. Which is the most common complication in meningitis is seizure, because it's 30% of patient present with the seizure in meningitis. So other complication like subdural empyema or effusion is commonly seen after meningitis with H. influenzae. So brain abscess and neurologic impairment, sensorineural deafness, especially after H. influenzae infection, and ventriculitis and arachidonitis, and neurological impairment is more than the hemiplegia. Aphasia and mental retardation and blindness can be present, and another complication is hydrocephalus and cranial nerve pulses may be present. So, sensorineural hearing loss, in which infection of meningitis the sensorineural hearing loss is present? This question can be asked multiple times in different examinations. So, we should know the S. influenza infection causes 5 to 10% of patients with S. infection causes the sensorineural hearing loss. Thus, the auditory brain stem evoke response, also called as brain stem evoke response audiometry, BERA test is done before discharge for the hearing assessment. So another important topic asked in meningitis, the CSF finding. So basically, you should know the pressure, CSF, cerebrospinal pressure. It is a 50 to 80 millimeter of water, and protein is normal protein level is 20 to 40 milligram per deciliter, and leukocyte count is less than 5 and more than 75% lymphocyte, and glucose is more than 50 milligram per deciliter, two-thirds of the serum glucose. So this chart shows the different finding on the different causative organisms of meningitis. So we should look for the glucose. Basically, the glucose part is decrease in bacterial, tubercular, or fungal, but it is normal in viral meningitis. This is important finding. So by this finding, we can differentiate other meningitis with viral meningitis. So another good finding is like this CSF pressure. So CSF pressure is like elevated in bacterial, it's normal in viral, and tubercular and fungal also elevated. And cell, so basically lymphocytes is present in most of the type of meningitis. Polymorph cells are present in the this bacterial meningitis, and protein is basically raised in almost all. In tubercular and this fungal meningitis might be normal. And glucose, I already talked about glucose. And chloride, chloride is basically normal in the viral and this fungal meningitis, but it is low in bacterial and tubercular meningitis. So treatment of meningitis, I have already talked about this empirical therapy of meningitis, that is third generation cephalosporin, that is ceftriaxone or cefotaxime, and vancomycin. So this is after getting the antibiotic sensitivity. So the duration of therapy and on the base and antibiotic of choice and on the basis of organism, and this is also an important topic. So we should know at least the duration and antibiotic. Like most highest duration antibiotic therapy is required for the pseudomonas. If causative agent of meningitis is pseudomonas, the antibiotic of choice is ampicillin and gentamicin, and duration of therapy is 21 to 28 days. So other organism like 10 to 14 days in group B streptococci, agalacticus, and in the penicillin is the antibiotic of choice. And for gram negative, like rods E. coli, cefotaxime or ceftriaxone 10 to 14 days. For Streptococcus pneumoniae, third generation cephalosporin plus vancomycin we can use for 10 to 14 days. For H. influenzae, also third generation cephalosporin drug of choice, and duration is 17 to 14 days. And for Listeria meningitis, the antibiotic of choice is ampicillin or gentamicin, and duration is 21 days. And for MRSA, methicillin resistant staph, vancomycin is drug of choice, and duration of therapy is 10 to 14. So by this discussion, we just complete the common picture of meningitis, sign and symptoms, and laboratory findings, and causative organism. So on next topic we will discuss about tubercular meningitis.